research associate with the HERO, which stands for the Health Economics and Epidemiology Research Office, which is in partnership with the Right to Care and uses the Tembalatu clinic data to manipulate and formulate the implementation of the ARP program. So I'm going to show you, or I'm going to take you through the clinic in order to understand the patient flow and how the health providers operate in managing this patient flow. So you can follow me. This is the door that they use as they enter into the clinic for their visit, either medical or pharmacy visit. And as they get in, that's where they wait and sit for one of the clerks to come and collect their cards before they can go and retrieve those files from the final room. So after the patient's blue cards have been taken from them, this is the entrance door that they walk through at the reception. So as you see, this is what the patient will now see while they're waiting for their files to be retrieved by one of the clerks at the back of the filing rooms.
This is Traveling in Jovo. I'm working as an admin assistant team leader. We're using these books before. These two books. This one is for a doctor, this one is for a medication. If the patient is booked for medication, then we just write it here and then we fill out the file for medication. And the patient, she or you went to the pharmacy and collects medication. This one is for the doctor. If the patient, he or she is booked for the doctor, we just write the name and then we give the patient the number, and the patient, she or you go and see the doctor. And then after we are done everything, later on we are doing the stats, we calculate how many patients we've done for the day for medication or for the doctor. So that's where we're working before.
So here's the booking station, the reception area. So that's where basically after their files have been retrieved, they'll be taken to our lecturers over here, who initiates their visit for that day, depending on which visit they are here for. So after that has been initiated, then the patient will be called to receive the file. Then depending on the type of visit that the patient is for the medical visit, then the patient will then go straight to queue for the nurses. And you can follow me. So after the patient receives a file for the medical visit, then they'll start queuing here on this case to go and get their vitals taken. These are the chairs, they go all around the side. Then this side, that's where their vitals have been taken. Then after the vitals have been taken, then the patient will re-enter another nurse's queue where the vitals will be captured on the therapy edge computer system, which is the data management system. So those are the rooms with the computers where the nurses will be capturing the vitals on the computer. Okay. Then after this, the patient will then start queuing for the doctor. And this is where the patient sits and waits to get into the consultation rooms for the doctor. And all in all, we have like 12 consultations room. And this is the treatment room. That's where if the patients, the nurse, while taking the vitals, recognize that the patient is ill or something, or given the vitals, then the patient will be transferred to the treatment room. And that's when the physician or one of the doctor will then attend the patient in here. Those are added as the ill patients, the sick patients. So the patients basically will be seated in their order, the order number that they have been allocated at the reception. So once the doctor will get out and say next patient, then the the patient will go and enter in one of the doctors who's available at that point in time. As I've mentioned earlier, all in all we have 12 consultation rooms. This is the blood room. So if the doctor requires more lab test results, that's where the patient will come in, and these are the chairs that they sit. For these are the chairs that they sit and for their bloods to be withdrawn. Then after, the patient will take those blood samples down to the laboratory. Then after from the laboratory, which I'm going to show you later on, then the patient will return to the doctor that he or he was before transferring first to the laboratory. So once the patient is done with the doctor, then the patient, those that they were not required extra laboratory test, then that patient will then go straight to the pharmacy to queue for the medication, the ARV medication. So this is where they sit. This is the pharmacy waiting area. That's where the patient sits. But for the patient to come and sit, the patient has to first drop in the file in window 1. Then the pharmacist will take this file, allocate the patients with the new number for the pharmacy area. Then after some time, after they've done with the prescriptions and everything, then the patients will be called at one of these windows to receive the ARV medication. Then after receiving those medication, then they come and start queuing there for the booking station. Okay. That's where they come and sit for them to get their next appointment scheduled date.
Yes.
So after that is done, after the patient gets like the next appointment scheduled date, then the patient will exit, and this is the door that they use to exit the clinic with the medication, with the next appointment scheduled date. And this is it.